Hello dear children. So today we are going to start with the new topic. So what is the topic name? Yes, it is living longer and healthier lives. So children, when was the last time you feel ill? Yes, when was the last time you feel ill? Were you taken to a doctor? Yes, when you are not well, you are taken to a doctor. Yes, what instrument did the doctor use to examine you? Yes, what instruments they used to check you? Yes, did he or she give you any medicine to take? Yes, yes, they will give, right? Yes, so when you are not well, you will go to a doctor and they will use instruments to examine you and they will give you some medicines, right? Yes. So, to live a long and healthy life, we need many different things, right? Yes, to live long and to be healthy, we need different things. We need a clean environment and healthy, nutritious food, right? Yes, so we also need good medical care, right? Yes, so a long time back, human did not understand diseases and thus did not know how to cure them. Long back, human beings, they did not know about any diseases and they did not know how to cure them. But now we know, right? Yes, we can find out what diseases and we can cure it by having some medicines, right? Yes. So diseases were considered to be curse of God. In olden days, if a person is suffering from diseases, they think that it is curse of God. So they think that it is punishment by the God. But today, due to the tremendous progress made by the medical science, we understand why diseases occur. While in olden days, people thought that if one person is suffering from diseases, they think that it is the curse of God. God is punishing that person. But now, because of many improvement in the medical field, we understand why diseases occur. So several methods of diagnosing diseases have been developed. So today several methods of diagnosing diseases have been developed. So today we can find out from which diseases a person is suffering from by diagnosing, by examining. So many methods have been developed. So thousands of medicines are now available. So today we can see thousands of medicines to cure the diseases and more are being developed to treat different diseases. In this chapter, we will look at some major development in the field of medical science. Okay, so first is a clinical thermometer. So children, often when you fall ill, our body becomes warmer, right? Yes, when we are not well, our body will become warm. So this is known as fever. So fever is a sign of a disease. When you complain that you are not feeling well, your parents touch your forehead, right? Yes, when you are not well, your parents will check your forehead. They will check and say whether you are having fever or not. So they will check your forehead. They will touch your forehead to find out if it is warm or not. So when you say your parents that you are not well, so they will touch your forehead and say whether it is warm or not. But this does not give a correct idea, right, about the fever you have. So when they touch your head, it will not give correct information. So it might be warm. So when we touch the forehead, it will not give a correct information whether we have a fever or not. So they measure the temperature of the body with the help of a clinical thermometer. So you can see in the picture, it is a clinical thermometer. So in the picture you can see a man is testing his temperature with the clinical thermometer. So temperature is a measure of how hot or cold something is. So temperature means it is a measure of how hot or cold something is. So it is measured in degree Celsius or degree Fahrenheit. So the clinical thermometer is invented by. So this clinical thermometer was invented by Gabriel Daniel Fahrenheit. So this clinical thermometer help us to find the body temperatures. So who invented this clinical thermometer? Yes, it is Gabriel Daniel Fahrenheit. So what is this, children? Yes, so it is stethoscope. So when you're ill, you go to a doctor, right? Yes, so doctor examines your chest and back with this stethoscope. So doctor is able to listen to the sound of your heart and your breathing through this instrument. So this is called stethoscope. So it helps them to find out what you are suffering from. Yes, and the stethoscope was invented by the French scientist. It is called René Laennec. So next is microscope. So the microscope magnifies a tiny object and makes it look much larger. So this microscopes help us to see things which are too small to see with the naked eyes. So microscopes help us to find too small things which are not able to see with your naked eyes. So this first microscope was probably made by the Zacharias Janssen in about 1590. So this microscopes helps us to see things which are too small to see with our naked eyes. So this first microscope was invented by whom? As it is Zacharias Janssen in 1590. So this microscope contributed a lot to the development of medicines. With its help, scientists were able to see for the first time the germs that causes diseases. So because of this microscope, the scientists were able to see for the first time the germs. The germs will cause diseases, right? And so these germs were able to find out with the help of this microscope. So over the years, they have been able to identify germs that causes different diseases. So you can see in the picture, it is E. coli, the bacteria. So this seen under the microscope. So this bacteria is seen under the microscope. So this bacteria causes diarrhea. So the scientists find out these germs with the help of the microscope. So after finding some germs with the help of this microscope, it was able to become possible to find medicines that could cure diseases by killing those germs. After finding these germs in the microscope, it was able to find out some medicine to kill these germs. So today doctors examine the blood or urine of a patient under a microscope to see the germs. So when you are not well, you would have seen that doctor will take your blood and they will take your urine to check what diseases you are suffering from. So they will put your blood and your urine under these microscopes to see the germs, and after finding the germs, they will see which diseases you are suffering from and they will give the medicine. So next is machines that can look inside your body. So there are several new machines which have been developed by human beings which can look inside your body. So which will produce some pictures, right? It's like X-ray machines can take picture of the inside of the person's body. Even scanners will produce picture which shows more details that can X-ray photograph. So this X-ray machines can take pictures of your inside of a person's body. This scanner will produce some picture which shows more detail than the X-ray photographs. So different types of scanners available are ultrasound, CAT and MRI. So with the help of these machines, doctor can see images of bones and internal organs and find out the diseases a patient is suffering from. So this CAT means it is a computerized axial tomography. It is a X-ray computed to see what the person is suffering from. So what is MRI? So you can see in the picture. So man undergoing an MRI scan. So this MRI means it is a computer to make detailed of pictures of a inside of your body. It is test that uses powerful magnets or radio waves. So it is MRI full form is magnetic resonic imaging. So this MRI will help you to find the detail of pictures of inside of your body. So all the details of the inside of your body. It will scan all your body, this MRI. So next is surgery and anesthesia. So sometimes to treat a defective organ in the body, it is necessary to cut open the body and operate on the organ. So sometimes to treat a defective organs, so to treat some defected organs inside the body, it is necessary to cut open the body and operate on the organs. So if the person is having any problems inside the body, so if a person is having any problems inside the body parts, it's necessary to cut open the body and should operate the organs. So this is known as surgery. So through surgery, it is possible to repair the organ and to cure the diseases. So in some cases, it is also possible to replace the organ with the healthy one. So we can replace the organ with the healthy one. So the healthy organ can be replaced in the infected organs. So even we can see today, we can replace the heart, the kidney, right? Even we can replace many organs of our body. So ancient Indian texts mention surgery being practiced in ancient India. So surgery was very painful earlier. So when the surgery was it was very painful earlier. Now doctors makes the patients unconscious before operating. So now the doctor will make the patient unconscious before the patient undergoes operations, so that they do not feel the pain. So how the patient will not able to feel the pain? Because the doctors give the patients anesthesia to make them unconscious. So even the chloroform was one of the first drug to be used as an anesthesia. Before this anesthesia, chloroform was used to make the patients unconscious. Now doctor use anesthesia to make the patients unconscious. The first operation using chloroform was an anesthetic, was performed on 18th November 1847. So next is antibiotic. So these bacteria are germs which spread several diseases such as tuberculosis, cholera and typhoid. So you all know that bacteria are germs which will spread many diseases. So in 1928, Alexander Fleming So he discovered a medicine called penicillin. So this, which will prevent the growth of bacteria. So Alexander Fleming, he discovered the drug called penicillin, so which will prevent the growth of bacteria. He used the drug to cure many types of bacterial infections. Later, many other such drugs were discovered. They are called antibiotics. So these antibiotics are given to kill the bacteria, to prevent the growth of bacteria. So this antibiotics. So this discovery of antibiotics was an important milestone in the development of the medicine. So this antibiotics was very important milestones, very important develop in the field of medicine. So these antibiotics are given for a patients, for a person, to kill the bacteria. So next is vaccination. So this medicines such as antibiotics so cure diseases, but vaccines prevents diseases from occurring. So there's some medicines like antibiotics will cure the diseases, but some vaccines will prevent the diseases. Some antibiotics will cure diseases, but vaccines will prevent the diseases which will occur later. So if a person is vaccinated against a diseases, her or his body develops a ability to fight the germs that cause diseases. So if a person is vaccinated against some diseases, the his body will develop to have its body will have a ability to fight the germs which will cause the diseases. So in this period you can see all the people are getting vaccinated against which diseases? Is against COVID-19. So why they are getting the vaccination against this COVID-19? Because they want to prevent the diseases. They want to fight the against the germs which will cause this COVID-19. So nowadays you can see all the people are getting vaccinated to fight against the diseases called COVID-19. So these vaccines which act against several diseases such as tuberculosis, cholera and tetanus are available today. So some vaccination are available in the medical field to fight against some diseases like tuberculosis, cholera and tetanus. So this vaccines will be taken to fight against some diseases. So if a person do want to suffer from these diseases, he should get some vaccines to prevent these diseases. So nowadays you can see a newborn baby is also vaccinated. Why? To prevent some diseases. So the first vaccine to be discovered was against the diseases called smallpox. So this diseases was major cause of death in the 18th century. So in 18th century it was a very deadly diseases, this smallpox. So in 18th century the smallpox was a deadly disease. So an English doctor, Edward Jenner, observed that people who had a mild diseases called cowpox did not suffer from smallpox. So this Edward Jenner, he observed that people, those who had cowpox, they did not suffer from this smallpox. So he took some germs from the cowpox into the, and he injected that germs to the smallpox body. So he observed that people who had a mild diseases called cowpox did not suffer from smallpox. So he injected this cowpox germs into the body of the young boy in 1796. So a few weeks later he injected him with the smallpox germs. So this boy did not get smallpox. So he successfully tried this method of preventing smallpox on other people. So Edward Jenner had discovered a vaccine for smallpox. So who discovered a vaccine for smallpox? As it is Edward Jenner. So today we should thank him, right? Because smallpox had been removed from the world. Since then, vaccines have been developed against many diseases such as polio, tuberculosis, hepatitis, cholera, and tetanus. The next is pasteurization. So let's see what is pasteurization. So Louis Pasteur, a Frenchman, studied the causes of diseases. So he showed that many diseases are caused by tiny germs. So this Louis Pasteur, he discovered that what is the causes of diseases. So he showed that many diseases are caused by small germs. So these germs also carried diseases from one person to another. So he found that so these small germs is a causes for the diseases. So these small germs can be killed by eating. So he discovered that eat kill these germs. So he said that germs also will carry diseases will from one person to another. So he discovered that eat will kill these germs. So milk or water can be boiled to kill germs in that and prevent diseases. So we need to boil water, even we need to boil milk. So it will kill the germs. So without boiling, without eating, we should not eat. So the eating will kill small germs. So the process of killing germs by boiling followed by rapid cooling. So especially in milk is called pasteurization. So pasteurization means the process of killing germs by boiling. So next is antiseptics. So Joseph Lister, a surgeon, lived about 150 years ago. So at that time, surgery was new and many patients died after operation. Why? Due to infections of the wound. So at that time, during early days, the surgery was new. Many patients died after the surgery. Why? Because of some infections in the surgery places. So in surgery places, you can see some wounds. So many people died because of the infections of the wound. So Lister tried this. Joseph Lister tried several methods of controlling the infections without success. Then he studied Pasteur's finding out germs. So he realized that germs cause the infections in the wound and started looking for the method of killing the germs. So Louis Pasteur, he discovered germs, right? So he said that there are many germs which will cause the diseases. So he studied the Louis Pasteur's germs, and he realized that germs will cause the infection in the wound, and he started looking for the method to kill the germs, and he tried a chemical called carbolic acid, and he sprayed carbolic acid in the air and washed his hands, so instruments and the patient's skin with it before performing an operation. So before performing an operation with the carbolic acid, he sprayed this carbonic acid in the air and washed his hands with this carbonic acid and instruments and the patient's skin. So before performing an operation. So before performing an operation in the operation theatre, he sprayed this carbonic acid in air and he washed his hands with this carbonic acid before surgery, and he washed his instruments used with the do the surgery. He washed this instrument which is used to do the surgery with this carbolic acid, and you wash the patient's skin also before performing the this operation. So the deaths due to infection came down dramatically. So he did the surgery by washing with the carbolic acid, and he washed some surgery instrument which is used to for the surgery. He washed with the carbolic acid. He washed the skin of the patient with the carbolic acid. It was very successful. So no infection was there in the body of the surgeon person. So Joseph Lister had discovered the first antiseptic chemical that kills germs. So in this picture you can see Joseph Lister. In the center is a Joseph Lister and the carbolic spray. So you can see they are spraying this carbolic spray before doing the surgery, before doing the operation. So keeping healthy. So you all know that germs causes several diseases. So many diseases are also caused if we do not eat proper diet. So if you are not following a proper diet, you will also suffer from the diseases. Not only germs will cause diseases. So if you are not following a proper diet, you will suffer from diseases. We can remain healthy by following some simple rules which take care of these two factors. So eat good nutritious food which gives the body all the nutrients it needs. So keep yourself and your surroundings clean. This will prevent the breeding and spreading of germs. So if your surroundings are clean, this germs will not spread in your surroundings. So keep your body clean by having a bath with soap and water every day. So we need to take a bath every day to kill the germs. To take a bath, use soap and water, clean water. And even we should wash our hands with soap and water before and after eating. So we should wash our hands with water before and after eating. So this will prevent the germs to get inside our body. Next is garbage breeds germs. So the garbage, if in your near to your house, if you have a garbage, it should be clean. So because the garbage will breeds the germs, it will give birth to the germs, and insects spread germs. So therefore always keeps the garbage covered. Dispose it from the time to time and do not allow it to accumulate. So exercise regularly. Exercising strengthens the body and it becomes more capable to fight against some diseases. So every day we should have exercise. We should do the exercise. So it will help us to fight against some diseases. So when you feel unwell, go to a doctor. So doctor will find out what diseases you are suffering from, and using some of methods you have read about in this chapter. So if you are not well, please visit a hospital. So please consult a doctor. So they will examine you by using some instruments you have already read in this chapter, right? So they will he or she will give you the proper medicine to cure you from some diseases.